Estoy grabando.
Hi, this is Aimee Pantaleon. This is my head-to-toe assessment for Maribel University. Prior to getting into the room, Rodolfo emptied his bladder. His vital signs were stable. We are going to start with the inspection of head and face. Okay, and I'm going to palpate the skull in a gentle rotatory movement from front to the back. His skull is symmetry and smooth. Okay, I'm going to inspection of the facial feature for shape and symmetry. I'm going to palpate to the facial features and for symmetry too. I'm going to inspect the skin. For skin turgor, I'm going to pinch a small section of the skin on the forearm. His skin turgor is good and has a good motility too. I'm going to inspect the eyes. I'm going to evaluate the eyes fixation by the counter and encounter the cover and uncover test. Okay, I'm going to ask him to look at me straight. I'm going to cover the left eye and I'm going to evaluate the right eyes. And I don't see any abnormal movement of the eyes. Now I'm going to cover the left eyes and I'm going to cover the right eyes to evaluate the left eyes. Look at me straight, please. I don't see any abnormal movement of the eyes either. Okay? I'm going to next to evaluate the extraocular movement of the eyes. Okay? I'm going to ask him to look to my finger. Okay, laterally. Follow my finger up. Sorry. Up. Down. Down. Okay. I'm going to ask him to cleanse your teeth, please. Okay. Okay. I'm going to ask him to squeeze eyes tightly. Wrinkle forehead. Wrinkle your forehead, please. Smile. Stick out your tongue. Puff out your cheeks. Good. I'm going to inspect now the ears. Okay, I'm going to look at ears bilaterally. I'm going to look for the auricles in alignment. Love without mass or lesions or tenderness. I'm going to do the nose inspection. Okay. Look up, please. The nose shows no discharge or polyps. The mucus are pink and moist. No edema. No sinus tenderness to palpations. I'm going to inspect now the mouth. Okay. I'm going to put some gloves on. Can you open your mouth, please? Can you elevate your tongue, please? Oh. Okay. The buccal mucosa is pink and moist without lesions. The gingiva is pink and firm. Okay, I'm going to inspect now the pharynx. Open your mouth, please. The pharynx is clear without erythema. Okay, I'm going to palpate the scalp and hair and facial bones. Okay, I'm going to palpate from front to back, the facial bones too, the temporomandibular joints and the sinus regions. Okay, I'm going to test for light sensations. This is the cranial nerve number 5. Okay, I'm going to check the forehead, the cheeks, and the chin. I'm going to use first a cotton swab. Do you feel it?
Yes, I feel it.
Do you feel it?
Yes, I feel it.
Okay, and I'm going to do the same with a disposable pin. Okay, do you feel it?
Yes, it's sharp.
I will be touching you with a sharp object like I did before. That object is disposable and has not been used on anyone before. Report me whether they feel sharp, although you did already. Okay, and I'm going to inspect now the articles for size, shape, and symmetry. I'm going to palpate the articles and mastoid area. Okay. I'm going to put gentle on the lobule. Perfect. I'm going to now I am going to do the whisper test. Okay, I'm going to mask the heating in the on-test ear by having the patient insert the finger in the ear canal and whisper 3 letters. I'm going to whisper 3 letters. Okay?
ABC.
Now I want you to do the same in the opposite ear, please.
1, 2, 3.
Okay, I didn't. Next, I'm going to test bone and air conduction with the Rhine test. Okay, and tell me when the sound is no longer heard. Okay.
It stopped.
Stop.
No. I can't hear it. Now stop.
I'm going to check now the right. Tell me when I stop.
No, it is still shaking. Now stop. Now stop.
Your air conduction is heard twice as long as bone conducted sounds. And now we are going to assess unilateral hearing loss with the Weber test. Okay? Is the sound heard equally in both ears? Yes?
Yes.
Okay, the find is no lateralization noted. Okay, now we are going to inspect the nose with an otoscope. Okay? Look up again. No discharge or polyps noted. The mucus is pink and moist. The septum midline is patent bilaterally. No edema over frontal and maxillary sinus. Okay, and no sinus tenderness upon palpation. Okay, we are going to check now the mouth and the pharynx. We're going to inspect the lips, the buccal mucosa. Please, can you open your mouth? Okay. The gums, the soft palate, the tongue in, please, inside. Okay, and the floor of the mouth. Can you sting up the tongue, please? Perfect. The findings: the buccal mucosa is pink and moist, okay, without lesions. 26 teeth present, gingiva pink and firm. The tongue is midline with no tremors or lesions. The molars are present too. We're going to test the gag reflex now. Say ah.
Ah.
Okay. The pharynx is clear without erythema. Tonsils are +1 without exudate. The gag reflex is intact with no hoarseness. We're going to do now the inspection of the neck. We're going to look at the neck. Okay, the inspection of the neck, looking for bilaterally distension of the jugular vein. Okay, I'm observing for any distension of the jugular vein or prominence of the carotid arteries. I don't see any distension or prominence of the carotid arteries. Okay, I'm going to evaluate the range of motion by asking to flex the neck, please. Flex your neck. Okay, extend the neck, rotate to one side to the another one, and turn your head and neck. Okay. Do you have any pain or dizziness?
No, I don't have any pain.
I'm going to palpate. I'm going to do the palpation of the neck. First, I am going to palpate the trachea for midline position. I'm going to palpate the carotid pulse bilaterally. I am going to evaluate to detect tracheal tuggings. Next, I'm going to palpate the entire neck for nodes. Please bend your head slightly. Okay. I'm going to start checking the occipital nodes at the base of the skull. Okay. The postauricular node located in the mastoid process. The preauricular nodes in front of the ear. The parathyroid and retropharyngeal nodes at the angle of the mandible. The submandibular nodes halfway between the angle and the tip of the mandible. And the submental in the midline behind the tip of the mandibles. The superficial cervical nodes. The posterior cervical nodes along the anterior border of the trapezius muscle. The cervical nodes deep to the sternocleidomastoid. The supraclavicular area deeply in the angle formed by the clavicle and the sternomastoid. Now I'm going to auscultate the carotid arteries. Bilaterally. The thyroid. Next, I'm going to do the upper extremities. I'm going to inspect and palpate your hands, arms, shoulders, skin and nail characteristics. I'm going to inspect and palpate. I'm going to assess for pulses bilaterally, the radial pulse, the brachial pulse, the radial pulse, the brachial pulse. I need you to turn because I have to explain your back, please. Can you come with me? I'm going to cover you. I'm going to do an inspection of your skin and thoracic configuration. Okay, I'm going to palpate and percuss costovertebral angle by placing my thumbs at the level of the 10th ribs. I'm going to inspect respiration now. I'm going to palpate thoracic expansion by placing the thumb at the 10th rib like I did before. I'm going to do it again. Breathe, please. I'm going to evaluate for tactile fremitus by placing palmar surface on both hands and ask you to say 99. Can you say 99?
99.
Next, I'm going to be the same percussion bilaterally with the head bent forward. Can you bend your head forward? I'm going to do some percussion bilaterally. Okay, and then I'm going to ask you to raise your arms overhead, but I'm going to do percussion with the laterals. And anterior chest. From superior to inferior and medial to lateral. I'm going to percuss posterior chest, lateral chest, and diaphragmatic excursion. I'm going to do now the diaphragmatic excursion, okay? Take a deep breath and hold it. Take a deep breath, hold it, and exhale, okay? Okay, usually it's 3 to 5 centimeters, okay? The diaphragmatic is usually higher on the right than on the left. I'm going to auscultate, and I'm going to ask the patient to sit upright and breathe slowly. I'm going to let you know when to breathe slowly. Breathe slowly and deep through the mouth, please. I'm going to do the same in the anterior chest. And now in the lateral chest. Breathe normally, please. Now, I need you to lay down, please. Elevate your legs. I'm going to cover your legs. I'm going to pull up the gown because I need to inspect your abdomen. You're going to be covered at all times. Okay, I'm going to inspect for skin symmetry. Okay, respiration effort. Okay, and pulsations or heaving. After the inspection, I'm going to palpate the chest wall. The pericardium for thrills or pulsations. Okay, in the left chest, I'm going to palpate the apical pulse in the left chest. I'm going to palpate now for tactile fremitus in the anterior chest. I'm going to ask you to say 99 again, please.
99.
I'm going to palpate the nodes infraclavicular axillary. Okay, elevate your hand like this, please.
Look how beautiful you look.
Okay, next we're going to do the percussions in the anterior chest. Okay. Okay, I'm going to auscultate for breath sounds. And heart sounds too. I'm auscultating for the aortic sound, the pulmonic area, the Erb's point, the tricuspid area, and the mitral area. Now, I did already the inspection of the abdomen. Okay, I'm going to auscultate all 4 quadrants for vowel sounds. I'm going to auscultate now for broods in the aorta, the right renal artery, the left renal artery, the iliac, the right iliac, the left iliac, the right femoral, and the left femoral. I will do percussion for the tongue, the liver, and the spleen. I'm going to first to percuss all quadrants of the abdomen for sense of overall tympany or dullness. Tympanic is the predominant sound because air is pressed in the stomach and dullness is heard over our organs. After the percussion, I'm going to do a light palpation. And then I'm going to do the deep palpation. The right costal margin of the liver, I'm going to do it with the finger hook. the left quarter margin of the splint, the right and left kidneys, the midline of aortic pulsations, and the abdominal muscles. I'm going to do the inspection of the legs, feet and legs. I'm checking for the skin. I'm inspecting the skin and the hair distribution and the muscle mass. I'm going to palpate temperature, edema. The pulses are going to be bilaterally. I need to check the pulses bilaterally. I need to check the dorsalis pedis bilaterally, the posterior tibial, and the popliteal. I need you to sit down, please, because we now have to check now to do a neurological exam. Okay, we are going to do an evaluation of your cranial nerve. Number 1 is the olfactory nerve. Number 2 is the optic nerve. In that test, we test the distance and near vision. We did it before. Number 3 is the oculomotor nerve. Okay, that we test the visual fields for confrontation and extinction of vision. Inspection eyelids for drooping, inspection pupil size, and we test already the extraocular eye movement. Number 5 is the trigeminal nerve, that is the inspection of the face muscles. For atrophy and tremors, we did it before too. We palpate the jaw muscles and tongue when patient clench his teeth. We did it already. And we test the superficial pain and touch. We did it already too. Number 7 is the facial nerve. In number 7, we have to inspect for symmetry of facial features, the smile, the frown, the puffed cheeks, and the wrinkle for heads, and we did it already. He did it very successfully. Number 8 is the acoustic nerve. We test the segment of hearings with a whisper test that was done. We did the comparison of bone and air. We did the conduction that was done, and the lateralization of sound that was done too. Number 9 nerve is the glossopharyngeal, and number 10 is the vagus nerve. We checked the gag reflex for number 9 and was successfully done. Number 11 is the spinal nerve, that we test the trapezius, the muscles, strange, the shoulder against resistance. You can do it again. Can you elevate your shoulder, please? Okay, and we test the sternocleidomastoid mastoid muscle by turning head to the sides against resistance too. Can you turn? Put some resistance against my hand. And number 12, the hypoglossal nerve. We inspect the tongue in the mouth. We inspect for the tongue movement towards nose and chins. We test tongue strength with index finger when tongue is pressed against cheek. And finally, we're going to test the musculoskeletal system. We're going to check for reflexes. We're going to check the Achilles tendon. We're going to check for the knee. And we're going to check for the brachial. And the muscle strength, we did it already. We asked the patient to shrug shoulders, do some medial rotation with the shoulder, please. The shoulder, rotation of the shoulder. Okay, the other shoulder too. Okay, the temporomandibular joint, we did it already. He clenched his teeth already. The knee flexion, please, can you knee flexion and extension, abduction and adduction, and the feet and ankle. We are going to check for plantar flexion and dorsiflexion. I'm going to check now for the cervical spine and the lumbar spine. And my head to toe assessment is complete. Thank you so much.